Good evening. On tonight's episode of the Twilight Zone Hospital Edition, we're going to tell you a grave tale about Mr. Crandall, a 26-year-old diabetic male who was admitted in the hospital yesterday with a large abscess on his upper right arm. Dr. Lugosi started him on intravenous broad-spectrum antibiotics while waiting for wound cultures to return. Let's take a look and see how barriers to communication can affect patient care.
Good morning. You must be Mike. My name is Janine. I'm your student nurse. Could you please verify your first and last name for me and your date of birth?
Michael Crandall, April 6, 1940. Ow, my arm!
I'm sorry, what was your date of birth?
April 29th, 81.
Okay.
My arm is so bad right now. My test back yet?
No, not yet. Dr. Lugosi said that your arm was responding very well to the antibiotics. You should be feeling better.
Yeah, but it's worse than yesterday. It's like the bone's gonna fall off or something. Can you just check it out?
I just checked it a few hours ago and it was just fine.
Yeah, I know, but just look at the thing right here.
Wait, are you trying to say that I'm incompetent or something?
No, I'm just saying it's really bad. I think you should check it out. Please.
Did you see that? This nurse is guilty of a barrier to communication called challenging. Challenging is giving a response that makes the client feel they have to prove their statement or point of view. These responses indicate the nurse is failing to consider the client's feelings, making the client feel it is necessary to defend a position. Let's go back to the action and see what happens next.
Stop worrying. Dr. Lugosi deals with this type of stuff all the time. Here, take 2 of these.
Thanks.
Go ahead. You're very welcome. He is the best at dealing with this. You will be okay.
Are you sure?
Everything will be fine by tomorrow. I do promise.
You swear?
I swear.
You know everything, right? You won't lie?
It looks as though this nurse committed yet another barrier to communication. Unwarranted reassurance, using cliches or comforting statements or advice as a means to reassure the client. These responses block the fears, feelings, and other thoughts of the client. And worst of all, what the nurse is saying might not be true.
Hi Mike, it's Janine again.
Hey.
This is my student nurse Sarah. I'd like to introduce you to her.
Oh.
Hi,
Hey,
Mike.
Sarah, what's
My
up?
name's Sarah. I'm a student nurse today. Can I just ask you to tell me your name and date of
My name
birth?
is Michael. Ouch!
Oh my gosh!
Poor Mr. Crandall. He lost an arm and, more importantly, his faith in the healthcare system. All because an incompetent nurse failed to care. She gave this man false hope, unwarranted reassurance, and challenged his pain every step of the way. Let's rewind this clip, ladies and gentlemen, and show you how this should have played out.
Therapeutic to me injury must exist. Yeah, the stern is to arrest me now. Yeah, I'm back.
Her has the shooter.
Hi, Mike. I'm Sarah, your nurse today.
How you doing?
I'm good.
Oh, man. My shoulder's hurting worse than yesterday. Did you get the results back yet?
Not yet, but I noticed you seem to be in a lot more pain, and I want to take a look at your abscess because it seems to be bothering you more than when I checked it yesterday.
It feels like it's gonna fall out or something. It's
I'm just
terrible.
going to take a look, okay?
All right. Ow, I burns. No, I burns.
Okay, I'm going to call
Oh,
Dr.
jeez.
Lugosi and have him take a look at it, okay?
Oh.
Dr. Lugosi, can you please come to room 22? I want you to take a look at this. Thank you.
Thanks.
Did you notice the difference in this clip? This is the correct way for a nurse to have handled this situation. She demonstrated a therapeutic technique called acknowledging. The nurse did this by giving her recognition in a non-judgmental way that there was a change in the patient's behavior from her previous assessment. She knew the minute she walked in a room and looked at the patient's face that something was different. And that's how you provide optimal care. Tune in next week, and thanks for watching The Twilight Zone Hospital Edition.
Your next stop, the Twilight Zone.